Why does ERP therapy effectively rewire OCD brains? Imagine your brain as a network of roads, with some paths becoming well-worn over time. In obsessive-compulsive disorder, certain circuits become overactive, especially in areas like the orbitofrontal cortex, which helps us make decisions, and the striatum, involved in habits. These circuits get stuck in a loop, causing persistent obsessions and compulsions. Exposure and response prevention therapy works by gently guiding your brain to build new, healthier pathways. It does this through repeated exposure to anxiety-provoking situations without performing the usual compulsive responses. Over time, this process helps your brain learn that these triggers are not dangerous, weakening the old, overactive circuits. This is possible because of the brain's neuroplasticity, which is its ability to change and adapt. When you face your fears repeatedly without giving in to compulsions, your brain starts rewiring itself. Studies show that ERP can decrease activity in the orbitofrontal cortex, which tends to be overly active in OCD. It also enhances connections between areas responsible for controlling emotions and making decisions, like the dorsal anterior cingulate cortex and the ventromedial prefrontal cortex. These changes help your brain better regulate emotional responses, making it easier to handle anxiety without resorting to compulsions. Neuroscientific research using imaging techniques like PET scans confirms that ERP leads to lasting brain changes. These include decreased hyperactivity in key areas and improved communication between regions involved in cognitive control and emotional regulation. As your brain adapts, it becomes less reactive to obsessive thoughts, reducing the urge to perform compulsive behaviors. This process is called extinction learning, where your brain learns that the feared stimulus is not harmful and the compulsions are unnecessary. Most people undergoing ERP see significant improvement, with about 60 to 70% experiencing substantial symptom relief. It is considered the most effective psychological treatment for OCD and often produces long-lasting benefits, especially when combined with medication. The key is that ERP helps your brain develop new, healthier responses to triggers, breaking the cycle of obsession and compulsion. In essence, ERP rewires OCD brains by harnessing neuroplasticity to reshape overactive circuits. It teaches your brain that anxiety and uncertainty are manageable without compulsions, leading to a calmer, more balanced mental state. If you are considering this therapy, it is essential to work with a trained mental health professional who can tailor the approach to your needs. Remember, everyone's brain is different, and recovery is a journey that can be supported with the right treatment and guidance.